see that but this is on day 1 as well. So day 1, it's really rather exploratory. But you can see they're swimming around the perimeter, and this is fairly typical, and it'll take them quite a while to actually, just by chance, wander across and find the platform. And again, you can't see from where you are, but there are markings on the wall indicating that, to give them some signposts that that's where the platform is. But look what happens on day 5. Here's the anatabine-treated mouse. This mouse has now been treated for 10 days with anatabine, so 5 days before it was asked to do this study. But this one, which is also an Alzheimer mouse, has had no treatment or placebo treatment. And you can see this animal has gone straight to the platform very quickly in a very short space of time. It's really quite remarkable. So, and this one is not doing a whole lot better than he did on day 1, which is very typical of the Alzheimer mouse, unfortunately. So this is very encouraging to us, and we're very interested in this effect, and it's something that we're exploring very, very vehemently. And as I mentioned, in addition, this is something that's already available as a nutraceutical or food supplement. So the last little section, I'm going to talk about what can we do to offset our risk for Alzheimer's disease. And I think there's quite a lot. There's probably a lot more than you think. One of the things that we now know is that for whatever reason, these disorders all confer an independent risk for Alzheimer's disease. Well, what do I mean by that? Well, if you have hypertension and you have a small stroke, that can enhance and exaggerate Alzheimer's disease. So that's a clear link between pathology and making Alzheimer's worse. But for reasons that are still not clear, just having diabetes or just having hypertension without a stroke, or certain cardiac diseases, or high cholesterol or high triglycerides, all of those things are independent risk factors for Alzheimer's. And I put the word aggressive in here because I think our views about how well these disorders have to be controlled to mitigate risk for Alzheimer's is changing. We have to actually control them much more than we thought we needed to. So some of the recommendations that are out there for reducing blood pressure into what we consider a normal range might not go quite far enough to reduce the risk for Alzheimer's disease. But this is something that your doctor or your doctors can do. These are things that we really need to take care of. Having atrial fibrillation with pulse rates of 120 just isn't good enough. In not many years ago, that was considered okay, and people would let that pass. But actually, we know that that's a particular risk for Alzheimer's disease and will induce the disorder. So we should consider diet as well. And this is an area that we're learning more and more about. But my conclusions are that it's really a combination of dietary factors that might be protective if you look at the literature, rather than any one particular component. But there's been quite a lot of talk about the so-called Mediterranean diet, which I've detailed here a little bit, which consists of high intake of vegetables and fruits and cereals, and a lot of olive oil, which provides unsaturated fatty acids, a relatively high intake of fish, but low intake of saturated fatty acids, particularly those in meat and poultry and dairy products. And here's the piece I like, this regular but moderate amount of alcohol. So we talk a little bit more about that. But there have been quite a few studies now that show this type of thing, that if you look over a 10-year period, and I believe this was a study done in New York, on a large number of subjects, so we're not just talking about studies that are off the cuff or not reproducible. This is a large number. What you see here is a so-called survival curve. You start off with 100% of the population. 10 years in, if you look at the green, about 70% of them still don't have Alzheimer's. About 30% do. But also 10 years in here, approaching 50% of the ones in red have Alzheimer's. And so what's the